David, Steve, you all have more perspective than I do. Each from your own role, not only roles in this committee, but your lived experience. And so that's where I'm kind of thinking about next steps. What does the data point us to with those two examples in mind?
Thank you.
If I could build on both Lily's comment and maybe Kevin's last question. One thing I think is interesting, and then also Chief Swing's comment about what all this means. When we start digging into subcategories to sort of see where the hit rates are different, or what are the sources of differences in stops by what's the reason for the stop and so on and so forth. In some way, we're kind of in the same way that Connecticut group was taking their data and pushing it to really identify the source of the disparity. That I think that's ultimately what we want to do, is try to get to the bottom of it, and then the more specific we can be, maybe the better we might be able to be or able to tie it to a specific practice and think about whether it's necessary or not. So, as you know, Kevin, I think what you're doing makes a lot of sense, and maybe just in the way we frame it, this report in the future, we need to think about that as, all this subgroup analysis is to try to understand why we're seeing differences at a larger level. And even though we're aggregating everybody together, and that makes it very hard for any one department to do something, we create a model for agencies to look at data themselves, or for others who are going to look at data for specific agencies. They have kind of a template that they might be able to use, and which kind of gets to sort of a next issue we're thinking about, further steps. And I don't know if this is in our mandate, but I think it might be worthwhile, at least in future years, for us to maybe pick specific topics and add an appendix report that we can all contribute to somehow that might look at specific things. So we could do mental health, or we could have an appendix report which is a how-to on how to analyze specific data for an agency, or we can look at consent searches, or whatever is emerging as a topic that seems most relevant based on our thoughts and the public comment. It just might be a way that we can do things that would not necessarily be repeated each year, just because then the report would grow to 1 million pages every year, and poor Kevin, we'd age him prematurely. But we might be able to sort of be a little bit more exploratory, and maybe just use the full make use of the full range of the things that we can see in this just kind of really unprecedented and amazing data collection effort that's happening in the state. That's just a thought made for the next step.
I would love for us to work towards that direction, Steve. I think that the board's report between last year and this year is shaping up to start towards that path, right? We have some sections this year that are similar analyses that we performed in the previous year, and so there's some level of standardization, although there's much new content this year. And I think we've made a lot of improvements. But then this third section of the report that are like board directed, or I forgot exactly what it's called in the draft, but there's specific research questions. That's where the intersectional pieces sit. So that's where the consent search analyses lie. That's where the report specific research questions. And so I think the board's report is going in that direction, but I think that we can tailor it even more moving forward with specific research objectives or policy areas that we'd like to look at specifically towards the beginning of the reporting period, that we could then really drill down and put out some very specific analyses that would get at various policy objectives in the future. So I think that would be a great way for the board's report to move.
Brendan, do you have a comment?
Sure. I guess I've been thinking about this the whole meeting a little bit, and where we did at some point in time in making policy recommendations. Like, say, for example, if after phase 3 is complete and data comes back a year from now and it shows overwhelmingly that supervision stops and searches are not yielding anything except disproportionately affecting Black people, are we allowed to make a recommendation that that is not a practice that should be continued? So that's where my mind was going and thinking with regards to that. So.
It's something that we could evaluate, and then, much like the survey instrument or the stop data instrument, bring something back to the board for larger discussion as a board, and because that would, I don't know if that would require legislation or if it would just require policy at the local level, but that's something that would be a larger conversation. All right, so I will ask the question of DOJ staff. Are we good on next steps, discussion of next steps? I'm not sure who that question goes to on the team.
This is Kevin. So yeah, I think that I have some notes here and some follow-up, and we'll be working a lot on some of the feedback that we've received on some clarifying points about existing report content, adding in, for example, the number of cases that fall into various categories in areas where some of those numbers are low, because that seems like a point that's been brought up throughout this section of something that people would like further information on. So we've got some revisions that we can make to existing content based on the discussion that was had here today. So I definitely have a bunch of work for us moving forward as a result of this meeting. So thank you all.
So thank you, and thank you to the committee for your work this afternoon, the public for your comments, and of course the DOJ team for your continued work supporting the RIPA board. So with that, we will adjourn the meeting at 3:54. Have a great evening and weekend to all. Thank you.